Very good evening to everybody. I am very honored, very happy, extremely thankful to Samsiddhi team, Principal, Coimbatore Ayurveda College, my beloved student Dr. Poyamuri, Chandramoli, and others for inviting me to give a talk on the day one. Today we are going to talk about dermatology, which is a very dry subject, highly ruksha. It's a very dry subject. Chikitsa also will take a long time. We will see what can we do. Functions of skin. Melanin pigment protect the skin from harmful effect of ultraviolet rays. Skin is the site of formation of vitamin D. Superficial sensation felt by normal skin play an important role in preventing injuries. Ayurvedically, skin is the structural component of Rasadhatu. Skin is derived from mother and its appendages from father. Bone, nagam, kesham, all the useless organs are from the father. Has 7 layers like avabhasini, lohida, etc. Its thickness is talked in terms of size of rice grain. Every layer is prone to get a particular skin disease. Tatsara Purusha is explained. Forms the superficial layer of shaka and protect other organs. Vata is responsible for sensory perception, Pitta for color and complexion. Skin is the source of absorption of medicines used for Abhyanga, Udvartana, Swedana. Skin, there are cutaneous manifestation of systemic diseases. In Ayurveda also it is there. Kamala, Pandu, Jara, Raktapitta. There will be skin manifestation. For example, acanthosis nigericans, black color around the neck, is seen in insulin resistance. So, cutaneous manifestations are also seen. Hair and nails are epidermal appendages. Charaka says that 29,956 hairs are present in the body. If you have doubt, please count it. Nagam and Romam are told as Mala of Astidadu. Kesha Naga Vriddhi is a symptom of Madhimega and Shaya. If you see the classification, there is an order in which the things are classified. Jara is the first chapter and Vadaraktam is the last chapter. Jaram denotes Sida Snigdam Agneyam with Amam and Vadaraktam denotes Ushna Ruksham Dadapagam Vidaki Kotavasta where the Dosha Chikitsa ends. Kushtha comes in the middle. Vadaraktam and Kushtha go hand in hand. Bhavishyada Kushtha Sama. In modern medicine, rheumatology and oncology go hand in hand because both of them use immunosuppressives in their treatment. So, first one is Nagaveda, Nagam is Achedanam. From Nagam, slowly he is taking to the upper consciousness and talking about various systems. And the last one is Anavastida Chittatva. Bipolar personality, cyclothymic personality disorder, where the neurotransmitters are affected. So this order of unfolding the diseases, whether it is Nanatmaja Vyadis or whether it is Rasayana Vidhi or whether it is unfolding the Nidana in Madhava Nidana, it is very unique. It is very unique. After Jara, they talk about Adhisara, that's the beauty. Then Raktabita comes. So this is the beauty of the order. Various major dermatological diseases are explained in the chapters of Kushtha Roga. Many English books translate Kushtha into leprosy. Kushtha is not leprosy. Few conditions, Dadugada, Asti Dadugada Kushtha, Kapalam resembles some aspect of leprosy. So Kushtam is a broad spectrum term which includes all the dermatological diseases mentioned in Ayurveda. Some of the skin diseases are mentioned in Kshudra Rogas. Venereal diseases like Piranga Roga are explained in Guhya Rogas. Cutaneous manifestations of various diseases are recorded. There are certain diseases which have the privilege of identifying as separate chapters. Siddhabittam, separate chapter. Visarpam, separate chapter. Vispodam, separate chapter. Masurika, separate chapter. So in my textbook of dermatology, I have incorporated all these things and put it into one book. Kushtha. Sarvam Kushnadi Tattva Bhugu. The disease is called Kushtha because it disfigures the body if not treated in time. There are 7 Maha Kushtas and 11 Kshudra Kushtas. The term Maha, severe, and Kshudra, the intensity of the disease. Dosha, Amsha, Amsha, Vigalpa, Anubandha, Sthana, Vibhagena, Vedana, Varna, Samsthana, Prabhava, Nama, Chikitsita, Visheshadaha. Doshaki Vigalpanai, Vigalpamana, Vigalpayanti, the Vigaran. The Amsamsa Galpana, Vigalpa Samprapti is very much important, depending upon the permutation and combination of various factors of the vitiated doshas, also their location in the body. There are different types of Vedanas, etc. in the Kushtha. Variation in the manifestation of disease is due to its location in different dhadus. In Kapalam, there will be pain and numbness. Kaganam, there will be color change. And in Rushyajikva, there will be shape of the tongue of the deer, antelope is mentioned. There are a lot of Nidanas, Virodhin, Annapanani, Viruddhaharam, Navanam, Dadi, Matsyam, Lavanam, Amlam. These things are Abhishanti. Ushna Snigdam is Abhishanti. Navanam is Abhishanti. Dadi is Abhishanti. Masham is Abhishanti. Dilam is Abhishanti. Matsyam is Abhishanti. Ushna Snigdam is Abhishanti. Vasantarudu is Ushna Snigdam. Women are Ushna Snigdam. Men are Shita Snigdam. That is why Masham is given in women in Magadi Garbhava Kranti. Ushna Snigdam Masham, Dravya Samanyam, Guna Samanyam, Karma Samanyam. Masham is given to the woman. Navanam, Dadi, Matsyam, Lavanam, Amlam. Lavanam is Abhishanti. Dosha Sankada Vicheda Janagam. Abhishanti. So Abhishanti told by 2 commentators are different. One produced by Madara Guna, Snigdha Guna, Amla Guna, Pichila Sobhava, produced blocks. The Srodas is called Abhishanti. But in another commentary, Srodasam Sravagam Abhishanti. In Lavanobhagita Snegam, in Charaka Sutram, 13th chapter, that type of commentary is told. So Abhishanti Agaras, Abhishanti, Kledam, Dadupakam, Malasanjayam, Kavaigunyam, Agnimandyam are the main causes of Samprati we talk about. Kavaigunyam, Agnimandam, Kledam. Kledam is very important. Ushna Snigdam is Kledam because in Pitta Pragopa Lakshana, Kledam is told. Pitta se Daga Raga Ushma Pahidaga. Sweda Kleda Srudi Koda. So the Kledam is told in Pitta Pragopa Lakshana. And in Ahara Parinamagara Bhava, Kledam is told. The word Kledam is used in Pramegam, Kushtam, Shofam, Visarpam. So they are all having Abhishanda, Kleda are very much related. What we call Amam, same is called Abhishandam in Shalakyam. Aharam, Masha, Mulaga, Pishtana, Tilakshara, Gudam, etc. Gudam is a Pramega Hedu, Kleda Vardana, Ajiranam is important Karana. Then Chardi Vega Pradigada, controlling Chardi Vegam, Kalechana, Anamasarana, that is not doing Panchakarma in proper time. Sharat Kala Prabhavasya, during the Prabhavama Sharat Kala, these Kushtha diseases manifestation is more. Vyayama adisantapa adibhukta upasevinam. Drinking cold water immediately after exposing to sun. Too much of physical exertion. This is very important, Nidana. Very, very important. Vipran gurun karshayadam pabam karmaja gurvada. Not respecting the guru is one of the paba. Vipran gurun pabakna yoga means daiva vivasaraya chikissa. We give panjagavi gridam, especially in paparoga karmas. In daiva vivasaraya chikissa we do for two diseases. One for anapatyada, infertility, and another one for unmada and apasmara, and another one for switra. These three are considered as papaja rogas. Vipran gurun garshayadam pabam karmaja gurvadam. Now we will see some of the terms used in dermatology. Lesion. Lesion describes the area of the disease which is small. Eruption. Eruption describes more widespread skin involvement, normally composed of several lesions which may be primary pathology or due to secondary factors like scratching, secondary infection, secondary bacterial infection, fungal infection, etc. This is eruption. The macule and patch. Flat, non-elevated, round lesion is called macule. Less than 2 centimeter. Hyperpigmentation. Vyangam is a macule. Switram is a macule. Vascular dilation. Erythema. Ragam is a macule. When macule is big, you call it patch. In Ayurveda, it can be seen in Switra, Necha, etc. Lodradi Churnam is told in Vyangam. You see the vitiligo here. In vitiligo, it can be the kapha vriddhi in rasadadu. Pittakshayam, kapha vriddhi. In pittakshayam and kapha vriddhi, you have to select kadurasa aushadam. Kadurasa aushadam, which is tok prasadanam in nature. Kadurasam, tok prasadanam is usually not selected. Balladagam, chitragam are example. But here when you select kadurasa, kapha will come down, pitta will increase. When pitta will increase, brajaga pitta will come to its normalcy. Then normal color will take place. That is why gomutrasavam, chitragasavam, bhavida bringarajam, gajalindaksharam, hiriberaksharam, balladaga prayogam, gomutra baguji prayogam, talaga prayogam with takra. All are kadurasa in nature. Kadurasam rakta prasadanam in nature is used in macule and patch, that is in Sutra Chikitsa. Papule and plaque, small solid elevation, elevated skin lesion less than 1 centimeter in diameter. The majority of the papule elevation projects above the plane of the surrounding skin. A similar bigger lesion is called plaque. Papule, plaque. Most of the Kushtha rogas told in Ayurveda are papules and plaques only. You see this lichen planus and plaques in psoriasis. There is a psoriasis called the plaque psoriasis. Nodule, a solid swelling which is situated within the skin. A nodule may be better felt than seen. In Gambhira Vadaraktam, Gradidam, rheumatoid nodules are seen. Rheumatoid nodules are seen in fingers, wrist joint, sacrum. You can see the nodules. You see these nodules, rheumatoid nodules. In elbow joint also rheumatoid nodules are seen. Vesiculum bullae. It is an elevated round Nellica-like lesion in which some serous fluid will be inside, like Vispodum. It is a small elevated round lesion. Inside with a serous fluid or pus will be there. Small one is vesicle, big one is bullous. You can see in chicken pox, you can see in herpes, You can see in folliculitis. You can see it in Agni-Rogini. You can see it in Agni-Visarpam, vesicle and bulle. You see the small elevated round lesion inside with jalam is there. Classical kapha pitta avastha. Kapham is snigdham, pittam is snigdham. So tikta ruksham is the aushadha. So panchakarma, snegavana are contraindicated in Visarpa because there is kleda vriddhi here. Kleda soshanam has to be done. Tikta rasa pradhanya kleda soshanam. Kadurasa pradhanya kleda soshanam. Tiktam is lagu, tiktam is jwaragaram, tiktam is amabhajanam, tiktam is not vidahi. That is why tikta rasa aushadas take place more role in the Kushtha Chikitsa. Tiktagam, Mahatiktagam, the name itself is tikta. The tiktam is divided into two for practical purpose, Shodhana diktam and Samana diktam. Whenever the word Shodhana diktam comes, that indicates Kadagarogini. Whenever the word Samanadiktam comes in the sloga, that indicates Bunimbam. It is told in the commentary. Pustule, superficial elevated lesion that contains pus inside. That is called a pustule. Vispodum is the example. You see the pus here in this condition. Jaluga Vacharanam, Trayandyadi Kashayam, Amruda Gugulu, all these things are highly effective. Cyst. A spherical oval nodule may be a cyst when palpated. It looks like an eyeball. It contains liquid or semi-solid material. Cyst is called Granthi in Ayurveda. You have cyst, adnexal tumor, cystic hydradenoма. You see the cyst. Many cysts are benign. Wheel, Shidabittam and Udardam. Dermographism we call. All the red, elevated, evanescent, oedematous skin lesion, erythematous skin lesions are called wheel formation. Shidabittam. Shidabittam. Pittam is not Shidam. Vadam is Shidam. Kapham is Shidam. Shidabittam can be Vadanubandha Bittam or Kaphanubandha Bittam. Vadanubandha Bittam is Asugari Bittam. Kaphanubandha Bittam is Chiragari Bittam. Vadanubandha Bittam, Shidabittam. Kaphanubandha Bittam, Udarda Bittam. That is the difference. So, Shidabittam is acute, Udardam is chronic. So, Shidam is not the guna of Pitta. Shidam comes from Vada, which is Asugari. Shidam comes from Kapha, which is Chiragari. That is the difference between Shidabittam. Shidabittam is a separate chapter in Madhavanidhana. Shidabittam Kodam is a Nanatmaja Pitta Vigara. Raktadushti, it is a Lakshana. It is a Kshutra Roga in Ashtanga Sangraha. You see the wheel formation. Amrudara Danyadi Kashayam, Vilvadi Guliga, Basmam, Vibhudi, Utsadanam are highly effective. Then Trivrittu Churnam, Virejanam, then Punnavarai, Kasamartha Churnam, 2 grams every day at bedtime. Kandugana Ganam of Charaga are highly useful in urticaria. Amrudara Danyadi is very useful. Medicines like Varada Basmam, Kamaduga Rasa are also useful. Now we will come for secondary lesions. After primary lesion, by scratching you get secondary lesion or by erosion. Scale. Rukshake Shabu. Visible dry exfoliation of superficial layer is called scaling. Theriasis, silvery scales in psoriasis. Sidvam, Yagakushtam, Darunam. You see, scaling in plague psoriasis. Usually we apply Durdura Batradi, Yeladi and Vetpalai Thailam in scale. Kirdam can be applied externally also. Ulcer, Vranam, due to ischemia, infection or necrosis, it is called Vranam. Vranam management, everybody knows. Vranam due to TAO, Vranam due to diabetes, beautifully we can manage. Crust, dried discharge of serum, pus or blood, Vrana Vastu. Erosion, erosion of skin, Agni Visarpam. The skin is peeled off, epidermal necrosis. It comes in drug allergies. Some dangerous drug allergies are there. For example, penicillin, some injection, aceclofenac. It is called Steven Johnson syndrome. Very dangerous condition. Toxic epidermal necrolysis, it is called. It's very dangerous. And lichenification, chronic thickening of the skin along with increased skin markings, results from scratching or rubbing. Ayurvedically, it can be correlated to charma Kushtha. See, lichenification, lichen sclerosis, atrophy, seen in aged person, long-term usage of topical steroids. Atrophy is can be compared to Ruksha Pradhanya Vadajatwak Kabala Kushtam Kidibam. Atrophy. Scar. Scar is Vrana Vastu. Hypertrophic scar after a Vrana. Burrow in intertrigonous areas. Tunnel produced by the movement of parasite within the tissue. It is seen in scabies and larva migrants. Larva migrants. Pama and Kachu. Comedones. Acne vulgaris. Plucks inside the opening of hair follicles. Comedones. Padmini Kandagam. Yauvana Pidaga. We have very good medicines for that. Fissures. Vaibhadikam. Jivantyadi. Yamagam is told in this condition. Purpura. Raktabittam. Circumscribed hemorrhagic lesion up to 1 centimeter diameter, which is flushed with the surroundings of skin or mucous membrane. When purpura is big, you call it ecchymoses. It is seen in Raktabittam. Tiriyakada Raktabittam you can see. Pittanuvanda Vadam. You have, when Pittam is there, then Vada involves with Pitta, you have bleeding. When Kapha involves with Pitta, you have clotting. That is how it is. Some of the gunas are very important. The Drava guna, Ushna guna, we talk about electrolyte imbalance and all. Purpura and ecchymoses. In vasculitis, Ayurvedic doctors see cutaneous manifestation of systemic diseases. Lot of SLE cases come. Raynaud's phenomenon come. Raynaud's disease comes. Crusts syndrome, mixed connective tissue disorders. All these things come. Vasculitis. We should be very careful about the diagnosis. Temporal arteritis, which is the cause for frontal headache. P-NCA and C-NCA will be positive. Anti-neutrophilic cytoplasmic antibody. We have to check that. Sometimes they do biopsy also. These conditions can be very well treated with the banner of Vadarakta. That is why Bhavishya Kushtha Samam is absolutely, practically very useful statement. Wart is Charmakeelam, elevation, hypertrophy of the papillae and epidermis is Wart. You see the Wart, Agni Karmam, Kshara Karmam, Charakaitailam, Balladaga Gridam, Kukkuludiktaga Gridam, Rasagandhi Medigi can be given. Condyloma, Ubadamsam, Linga Arshas. It's a wart-like growth seen in genital and anal regions. Genital wart. Wait a minute. One minute.